Influenza viruses can cause some symptoms similar to the novel coronavirus, including sudden onset of fever and coughing. As anyone who's had it knows, it's more than just a cold. For some, it's deadly. The World Health Organization says that annual epidemics result in about 3 to 5 million cases of severe illness caused by influenza globally, and flu viruses kill somewhere between 290,000 and 650,000 people every single year. Those numbers are broad enough, but there's another factor. We have very sketchy information worldwide on how many people get the flu and don't end up in the hospital. That makes it tough to nail down exactly how deadly the illness is. A detailed running count kept by the Centers for Disease Control in the U.S. shows that this year so far, flu viruses in the country have killed somewhere around 1 in 2,000 people who caught them. Children and the elderly are the most likely to die. So even though we've been dealing with flu for centuries, there are huge gaps in what we know about it. Little wonder, then, that the data on the novel coronavirus is also very unclear and changes from day to day. The Chinese government has now said that it's identified well over 30,000 coronavirus infections in the country. And medics have confirmed that as of February 7th, over 600 people have died due to the new virus. In theory, that means 2 out of every 100 people who get the virus will die of it. That's a much higher rate than flu. But that number is attached to a major uncertainty factor. If some people catch it, but only develop mild symptoms or none at all, they won't be counted. So, if many more people have actually caught the virus, but haven't been tested because their symptoms have been mild, estimates of how lethal it actually is could easily drop once we know more. Numbers for pandemics are hard to collect, which makes mortality rates difficult to deduce. So far, the entire coronavirus epidemic hasn't killed as many people as on average die from the ordinary flu in a single day. But the very fact that it's new, and we still know very little about it, has authorities around the world worried. One thing we do know: wash your hands. That's one of the best ways to prevent getting any kind of respiratory virus.
Let's get more on this from Derek Williams from our science desk. Welcome, Derek. It's very salutary, that report there. So more people die of flu every year than from the entire coronavirus epidemic so far. So
every day.
Every day. So why aren't people sort of running out and buying masks every year to protect them against flu?
Well, I think that it boils down to the fact that we're just kind of used to it. Flu is sort of business as usual. We've been living with it for a very, very long time, and we can kind of predict when it's going to happen. There's a flu season in the Northern Hemisphere. There are also steps that you can take to prevent flu. There are vaccines that have been developed that can, for example, protect some of the people who are most in danger from flu, the elderly or children. And there are also medications in place, antivirals, for example, like Tamiflu. So there are prevention methods that are there. Unfortunately, none of those prevention methods work with coronavirus.
And as you said, despite the prevention methods, more people are dying every day. Does it make sense then, rationally, for us to be frightened of the new bug when so many of us don't think twice about flu?
Well, it boils down to a sort of this big gray number. Really, it's the mortality rate, right? We heard that it kills 2 in every 100 people that contract it. That's really a very uncertain number at this particular moment because in China, they're dealing with this health crisis, right? They're overrun with thousands of people who are pretty severely ill. They don't have any time. They don't have the resources to test people who might, for example, have the coronavirus, but have very mild symptoms or even be asymptomatic, have no symptoms at all. And so this mortality rate, this idea, it's killing 2 in every 100 people, I think that most researchers expect that to go down as we find out more about how many people actually contract it and what kind of an impact it would have in this what's probably a much larger group of people.
OK, I think those figures are important too, and every 100 and likely to go down. So let's just keep this all in proportion. So how do the two, coronavirus and flu, how do they compare in terms of the ease of transmission?
Well, contagion viral epidemiologists they look at what's called the basic reproduction number. It's called the R naught. Now, in terms of the R naught for flu is 1.3. Now, what that means is out of every person who gets flu during the flu season, they'll give it on average to 1.3 other people, which is how the flu season continues to be sort of this self-generating thing during the cooler months of the year. I read, we don't really have that number yet for the coronavirus, but I read a study last week that estimated that it would be around 2.2. Now, if that was true, that would be quite a worrying number, but we don't really have that information yet. We don't really have enough data to back that up yet because, as we said, we don't know how many people actually have gotten it yet. So the only thing that we really can say for sure is one researcher that I was reading an article today. He said the one thing that we know for sure is that this is a beast that's moving very quickly.
Okay, so briefly then, are there any other significant differences between the way that health professionals are treating coronavirus and flu?
Well, and they're still hoping, I think the WHO is still hoping very much for what they call containment within China, which means that they're going to be able to keep it from setting this coronavirus from having epicenters in other countries. As long as they can keep it contained, they would have then contained within the country. They can hope that at some point they're going to be actually even able to eradicate it, like they did with SARS. However, it's looking like it's infectious enough that that might not happen. And so it could very well be that within the coming years, this ends up being something that is like other coronaviruses, sort of endemic in the world.
Out there. All right, Derek Williams from DW Science, thank you.